Bhat, Director, Radhakrishna Multispeciality Hospital and IVF Center. Let's talk about pap smear today. Why do we think we should do pap smear? Pap smear is a screening test which is done for screening of cervical cancer. We all know that many women die of cervical cancer in our country. More than urban women, the rural women suffer from this problem. The causes of cervical cancer are early marriage, multiple childbirth, HPV infections, not taking care of personal hygiene, and repeated abortions. When we do pap smear, we are screening our ladies for cervical cancer and also the early changes which occur in the cervix before they get to become cancer. So we have to do a regular pap smears to rule out cervical cancer and a screening test. Now, who are the people who should undergo pap smear? Any woman who is sexually active above the age of 22 or 23 years up to 45 to 50 years should undergo pap smear routinely. Postmenopausal women should also undergo pap smear, but how frequently should we do? If one pap smear comes normal, then every 3 years the pap smear has to be done, and HPV testing is also very important, which is done every 5 years to rule out HPV infections. We also give cervical cancer vaccines to our ladies to prevent cervical cancer, which now is very commonly given to our women since 15 to 20 years because the cervical cancer vaccine has come, and this will prevent our women about 90 to 95% from cervical cancer. That is, it will identify the HPV strain and then it will kill that HPV strain. So let's all undergo pap smears regularly to rule out and prevent cervical cancer. Now you may ask me, I have not had a pap smear at all these years. Should I undergo? I would advise you to undergo pap smear test whenever you're undergoing an annual health checkup. So please ask for your pap smears and undergo an annual health checkup. Now, if there is no facility for pap smear, please ask your doctor to look at the cervix and if there is any lesion inside the cervix. There can be lesions like inflammatory lesions, which could be cervicitis. There could be lesions which have small ulcers and could bleed on touch, or there could be blood-stained lesions. So if a woman is having normal white discharge which is like curdy, or greenish white discharge, or it could be blood-stained, all these people should undergo a per speculum examination and a pap smear. So friends, please learn and understand about this pap smear and undergo this test so that you can prevent your women, your near and dear ones, from suffering from these problems of cervicitis, profuse white discharge PV, cervical cancer, and also prevent unnecessary hysterectomy. Suppose if it is a just normal cervicitis, then we will be preventing unnecessary hysterectomies. Thank you so much.